For my social work capstone project presentation, I chose to do mine on concerns surrounding the effects of transitions of older adults from hospital to home who have had experienced life-threatening situations. I chose this topic due to my internship at Virtual Our Lady of Lourdes, where I helped and advised patients and their families on what life is going to be like outside the hospital and help them set up with agencies, home care agencies, to help them with that transition as well. The project purpose statement. So by conducting a literature review, I looked at the aspect of financial issues that may be brought upon the patient and the caregiver and the resources that are offered. Since older individuals struggle with transitioning to post-discharge living, they struggle with support services such as retirement, relocation, and bereavement, along with the increased financial issues or medical issues due to their medical diagnosis. The three project questions that I looked into were what effects does the transitioning have on the older community, and what amount of stress does it have on the body, as well as what are the impacts on the caregiver's lifestyle and what supports are given as they care for a friend or family member. And also, is there a financial strain on patients and their caregivers that will affect the patient's care post-discharge? The methods I used for gathering my literature review were researching post-discharge care for patients within the older community and the effects after transitioning from the hospital to home after a life-threatening event, researching the patients returning home and those who go into nursing home facilities, as well as assisted living facilities after their hospital stay. By comparing different effects transitioning to the facility rather than home, and if there are positive or negative outcomes compared to the patient returning home, and also focusing on caregiver stress from a patient who transitions home. So the findings that I found were, for question 1, what effects does the transitioning have on the older community, and what amount of stress does it have on the individual's body? I found that it's important for individuals within the older community to be aware of the services that are specialized for their specific age group, especially when it comes to support groups and transportation. Lack of knowledge about the available community service and support, limited access to health and social services post-discharge, and difficulties assessing services due to lack of transportation. It was found that after being discharged from the hospital, that individuals have a decreased sense of independency, which is why it's important to educate them on what's out there to help them. Findings for question number 2, what are the impacts on the caregiver's lifestyle and what supports are given as they care for a friend or family member? I found this to be very important to note, because when you're caring for a patient, you're not just you have to look at the whole aspect of the patient and their caregiver, their family members, their friends that are going to be caring for them have to be put into the picture. So, because as stated here, caregiving often results in chronic stress, which compresses caregivers' physical and psychological health. It also gives them feeling of distress and depression associated with caregiving, also negativity on the caregiver's physical health. And even when demands become more intense and result in high levels of stress or depression, they often cite positive aspects of the experience because obviously they chose to live the caregiver lifestyle, and they need to be also aware of the help that's out there for them as well. And also for question number 3, is there financial strain on patients that will affect the patient's care or post-discharge? It was found that 21% of married Social Security recipients and 43% of single recipients age 65 plus depend on Social Security for 90% of their income. So when they have an unexpected incident, such as a hospital stay, this could put a huge strain on their financials if they do not have the supports at home to help them be educated about their financials. And then I also found that potential initiatives should be considered to help at-risk older adults find resources to improve their financial health literacy, which in turn will enhance their abilities to manage medical choices in the environment of an increasingly complex healthcare system. Implications for social work. It was found that the current generation of the older community struggle with the transitions to home after experiencing a life-threatening situation. During these transitions, the elderly individuals struggle with the loss of independency and sometimes may need the help of a family member or friend or an outside service, such as transportation. It was also found the importance of not only putting focus on the patient's health, but also the caregivers to maintain a healthy lifestyle for both. For future research, potential initiatives should be considered to help at-risk older adults find resources to improve their financial health literacy, and this will enhance their abilities to manage medical choices in the environment of an increasingly complex health system. So this will help them to understand the health system better and also their finances and also the people to trust with their finances. And for the competencies, I use evaluate practice and individuals, families, groups, organizations, and the communities. And this is apply evaluation findings to improve practice effectiveness at the micro, meso, and macro levels. And there is always changes going on within the healthcare setting, so it is important to stay up to date with changes and to recognize when someone needs to be changed to provide a better outcome, especially those in vulnerable populations such as the older community. And also competency 3, advance human rights and social, economic, and environmental justice. And this is to apply understanding of social, economic, and environmental justice to advocate for human rights at the individual and system levels. And this is to provide the best efficient and quality care for a patient and to be alert of all resources available to them and to be knowledgeable on those resources to be able to educate them. And that concludes my presentation. I hope you enjoyed it.